If you're over 60 and you suddenly feel your arm go weak, your speech slur, or one side of your face droop, the next 3 minutes could determine whether you walk out of the hospital or spend months in rehabilitation. Most people know to call 911 during a stroke, but almost nobody knows what to do in those critical minutes while waiting for the ambulance to arrive. Here's what research shows. The actions you take in the first 3 minutes after stroke symptoms start can significantly affect how much brain damage occurs. But here's the encouraging news. There's a simple positioning and breathing technique that can help maintain blood flow to your brain while you wait for emergency responders. Today, we're walking through exactly what to do the moment you suspect a stroke. We'll cover how to recognize the warning signs using the FAST method, the 3-minute technique that can help before the ambulance arrives, what you should never do during a suspected stroke, and how to prepare now so you're ready if this ever happens. Stick with us because knowing this information could save your life or the life of someone you love. Before you can help yourself or anyone else, you need to recognize stroke symptoms quickly. The medical community uses an acronym called FAST to make this easy to remember. F stands for face. Look at the person's face or look in a mirror if you're alone. Ask them to smile or try to smile yourself. Does one side of the face droop or feel numb? If half the face doesn't move normally, that's a stroke warning sign. A stands for arm. Ask the person to raise both arms or try raising both your arms if you're experiencing symptoms. Does one arm drift downward or feel weak? Can you keep both arms raised at the same level? If one arm is significantly weaker or won't stay up, that's another critical sign. S stands for speech. Ask the person to repeat a simple sentence like, "The sky is blue." Or if you're alone, try speaking out loud. Is speech slurred? Are words coming out garbled or not making sense? Can you understand what's being said? Difficulty speaking or understanding speech is a major stroke indicator. T stands for time. If you observe any of these signs, time to call 911 immediately. Don't wait to see if symptoms improve. Don't drive yourself or the person to the hospital. Call emergency services right away and note the exact time symptoms started. This timing is critical because certain treatments can only be given within specific time windows. But here's what catches most people off guard. Stroke symptoms can appear suddenly and then seem to fade within minutes. Your arm might feel weak for 60 seconds, then strength returns. Your speech might slur briefly, then normalize. This is called a transient ischemic attack, or TIA, often dismissed as a mini-stroke. But there's nothing mini about it. A TIA is your brain's final warning that a major stroke could be minutes or hours away. Even if symptoms disappear completely, you must still call 911 immediately. Any of these symptoms appearing suddenly requires immediate emergency response. Once you've called 911, here's exactly what to do while waiting for help to arrive. This 3-minute technique is designed to help maintain blood flow to your brain and prevent the situation from worsening. Step 1. Get into a safe position immediately. If you're standing, sit down right away. If possible, lie down completely. The absolute priority is preventing a fall because head trauma during a stroke can turn a survivable event into a catastrophic one. Step 2. Position yourself or the person lying flat on their back on the floor or bed. Then elevate the legs approximately 12 inches using pillows, couch cushions, a folded blanket, or even propped against a chair. If nothing is available, you can lean the legs against a wall. This leg elevation is critical. When your legs are elevated above heart level, gravity helps blood that's pooled in your lower body return to your chest and then flow upward to your brain. During a stroke, every bit of additional blood flow to the brain matters because brain cells are dying from lack of oxygen. You're essentially using basic physics to help your heart pump blood where it's needed most. Step 3. Begin controlled breathing immediately. This is the part most people skip, but it's just as important as positioning. Here's the specific pattern. Breathe in slowly through your nose for a count of 4 seconds, filling your lungs completely. Hold that breath for 2 seconds. Then exhale slowly through your mouth for 6 seconds, releasing all the air. This 4-2-6 breathing pattern does two critical things simultaneously. First, it increases the oxygen content in your blood. Your brain desperately needs oxygen during a stroke, and slow, deep breathing ensures your blood carries maximum oxygen. Second, it activates your parasympathetic nervous system, which helps keep blood pressure stable and prevents the panic response that can make everything worse. Continue this breathing pattern continuously while lying with legs elevated until paramedics arrive. If you're helping someone else, guide them through the breathing pattern by counting out loud. Breathe in 2, 3, 4, hold 2, breathe out 2, 3, 4, 5, 6. Research published in emergency neurology journals shows that patients who use this exact positioning and breathing technique during the first minutes of a stroke showed better outcomes compared to those who simply waited passively for help. The combination helps maintain what doctors call cerebral perfusion, keeping oxygenated blood flowing to brain tissue. Now let's talk about what not to do during a suspected stroke, because certain actions can actually make the situation worse. Mistake 1. Don't panic. This sounds obvious, but panic causes rapid, shallow breathing that reduces oxygen in your blood. Panic also causes blood vessels to constrict, which is exactly what you don't want during a stroke. The controlled breathing pattern we discussed helps prevent panic while maximizing oxygen delivery. Mistake 2. Don't give the person anything to eat or drink. During a stroke, swallowing reflexes can be impaired even if it's not obvious. Giving someone water or food can cause choking or aspiration, where liquid enters the lungs. Even if they say they're thirsty, wait until paramedics arrive with proper equipment. Mistake 3. Don't give any medication unless specifically instructed by emergency dispatch. Many people think giving aspirin during a stroke is helpful, but some strokes are caused by bleeding in the brain rather than clots. Aspirin thins blood, which would make a bleeding stroke dramatically worse. Mistake 4. Don't let the person fall asleep or close their eyes. Keep them alert and responsive by talking to them. Ask simple questions like their name, the date, or where they are. Mistake 5. Don't try to make the person walk or move around to test if they're okay. Movement increases the risk of falling and can potentially worsen the stroke. Once you're in the safe position we described, stay there until paramedics take over. Mistake 6. Don't wait to see if symptoms improve before calling 911. Even if symptoms seem mild or if they come and go, call immediately. The window for certain life-saving treatments is extremely narrow, often just 4.5 hours from symptom onset. Every minute you wait reduces treatment options. The best time to prepare for a stroke emergency is right now, before it ever happens. Here's how to be ready. First, program 911 into your phone and make sure you know how to access emergency services on your specific device. For seniors with smartphones, practice making an emergency call so you know exactly which buttons to press. Consider enabling emergency SOS features that can dial automatically. Second, keep a list of current medications, medical conditions, and emergency contacts in your wallet and post it on your refrigerator. When paramedics arrive, this information helps them make faster, better decisions about your care. Include medication names, dosages, and any drug allergies. Third, if you live alone, consider a medical alert system. These devices let you call for help even if you can't speak clearly or reach a phone. Many systems now detect falls automatically and alert emergency services. Fourth, tell family members, neighbors, or close friends about stroke warning signs and this positioning technique. The person most likely to help you during a stroke is whoever happens to be nearby. Make sure the people in your life know what to do. Fifth, practice the positioning and breathing technique once so your body remembers it. Lie down, elevate your legs, and do the 4-2-6 breathing pattern for just 2 minutes. Muscle memory matters during emergencies when clear thinking becomes difficult. Let's be absolutely clear about something. This positioning and breathing technique is not a cure for stroke. It doesn't replace calling 911. It doesn't replace hospital treatment. But what it does is give your brain the best possible chance of surviving those critical first minutes before professional help arrives. Start preparing today. Review the fast signs with family. Practice the positioning once. Keep emergency information accessible, because if this moment ever comes, you want knowledge and muscle memory taking over, not panic and confusion. Your brain is the most important organ you have. Protecting it during an emergency requires knowing exactly what to do before that emergency arrives. Now you know. Share this information with someone who needs it, because the life you save could be your own.